WA researchers will conduct a world-first study to help prevent the early onset of Alzheimer's. They believe a hormone treatment will slow the development of the devastating disease.
Lenora Griggs' short-term memory began to fade 2 years ago. The 80-year-old later diagnosed with Alzheimer's disease.
Some things, they've gone, Wasn't important enough to remember.
A lot of the skills are lost. For some people it doesn't happen, but it has for Mum.
The great-grandmother's condition is caused by a build-up of a toxic protein called beta-amyloid. Research at the McCusker Foundation's WA lab has found testosterone can lower those protein levels in men and women.
Where we think it's going to have a huge role is to prevent this build-up of this toxic protein and thus delay the onset of this devastating disease.
There seems to be some improvement in mental function. This is very encouraging and needs to be proved in a larger study, of course.
In a world first, Professor Martins and his team have been given the green light to trial their theory. Over 12 months, they'll use testosterone to treat a group of men at risk of Alzheimer's.
There's no drug that's been shown to lower the risk of Alzheimer's effectively yet. So if it turns out to be the case, it's a huge development for the field.
About 1,300 Australians are diagnosed with Alzheimer's every week, making it more common than cancer or even heart disease. The trial will take 2 years.
Just means that if it pushes someone getting Alzheimer's back 5 years or 10 years, that will make a huge impact not only on the person but also on the family.
Claire Grantham, 10 News.